One of the common starting points that we use for back pain, it's the big three. When we are using the big three, our curl up, our side plank, and our bird dog, the goal is to create spine stiffness. All right, so modified curl up. When we are talking about modified curl ups, what we are trying to create is stiffness in our spines. What that really does is it sends a signal to our brain of safety. So we are just trying to, again, create stiffness in the short term to decrease pain. When we do it with the curl up, we're focusing on the front side of the abdomen. We're focusing on our abs, really. The way we want to go here, so we are going to go one leg straight and one leg bent. The goal of this position is to keep our pelvis in neutral. The next step here is we're going to take our hands, fold them on top of themselves, and then put them directly under your belly button in your low back. And again, this is just, we're creating spine neutral. We're not necessarily trying to have a big arch in the back, but we do want your spine to be in neutral here. The next step is going to be a crunch, like you would normally think of a crunch. The way we want to do it is think about our rib cage to the top of our heads as a plank. And what we're trying to do is hinge from that point just so the head lifts off the ground an inch or two. So we're going to go crunch in and then hold. And the way we're going to do this is 10 full seconds of holding here. Andy's going to start shaking a little bit because this is harder than what you would expect. It's sort of an upside down plank and back down. That's one really good rep. In between, I typically like to go 10 seconds on, 5 seconds off, 10 seconds on, 5 seconds off. So Andy's going to go for another rep here. Same thing, solid plank, straight from there, holding for 10 seconds. 10 seconds starts to feel really long, but in a really good way. And then down. Typically, we start with 3 sets of 10 seconds. Over time, what we want to build to is 6 sets of 10 seconds. That's a full minute of hold. That's what we're looking for. Our side plank that we use through the McGill Big Three always starts with us on our knees and on our elbow. The goal of this, again, just like it was with the curl up and the bird dog, is to create stiffness in our spine. This time we're focusing on the underside, so our obliques and our QL, we're focusing on the underside muscles. What we are going to do when we actually go through and do this is we are going to first create some stiffness by pushing our elbow down into the floor. That creates that nice straight line. We're going to think about using the bottom side glute, the bottom hip, to push ourselves forward and up into this nice straight plank. Just like with the other 2 exercises, we are looking for 10-second holds here, and they should be tight, right? Again, we're trying to create spine stiffness, it sends a very strong signal to our brain of safety, which decreases pain. And he's going to come back down. He's going to pause for about 5 seconds again, and then we do a second 10-second hold. So he's going to come right back up, pushing down through the elbow, forward through the hip. We almost want belt buckle up towards the sky, definitely not down towards the floor. I should see a straight line from knee to hip to shoulder and from knee to hip to shoulder. Again, 10 seconds and back down. Same rules, we do 10-second holds, typically start with 3 sets, working up towards 6. Bird dogs. So what we're doing with the bird dog, again, just like the other 2 exercises, we are creating spine stiffness. Again, that creates a big safety signal for your brain, which is going to decrease the pain in your back pretty effectively. The goal with our bird dog is to create length. It is not to bring your heel as high as possible. It is not to bring your arm as high as possible. It is to go as far apart as we can. So what we're going to do, opposite side arm, opposite side leg, they are going to go away from each other. We're going to create a fist on this side. We're going to think about the heel on that side and pull them apart. As we are trying to pull apart, we're holding for 10 seconds. Again, what we should have, if this is a good exercise for you, is a little bit of wobbliness. That's how this looks. 10-second holds. We come back down, always staying on the same side for as many sets as you have been prescribed. Typically, we start with 3. Andy, go again. We do 5 seconds of rest, 10-second holds. Again, same side till you get through all the sets. When you're done with the number of sets that we talked about, we just switch sides. And bring it down. We don't necessarily always want spine stiffness, but when you're in acute back pain, your brain has this massive threat signal that's coming up there. That's what our pain really is. The stiffness that we create through these 3 exercises sends a really big safety signal, and that's really what we're looking for to decrease the pain. One of the really cool things about these, going through all three of them, is it very often for people brings your pain down to none for, sometimes it's a few minutes, sometimes it's a few hours. It can be a really long time, but it's a very powerful, again, safety signal to your brain that things are okay, that you have stability in your spine again. It really helps you really feel better, get through your day, and overall just be able to live your life.